Hi, Mrs. Burnell. My name's Dr. Thacker.
How do you do?
It's nice to meet you. Do you mind if I examine you? Would that be all right?
Yes, that's fine.
Lovely. So I'm just going to look at you from here for the moment, and then I'll carry on examining you
Okay.
from there. Lovely. If I could just take your hand to start with. And your other one, that'd be all right. That's fine. Now, could you hold your hands out straight for me? Just going to put this on your hands. That's fine. Lovely, thank you. Great. Just turn your hands over for me. Lovely. Just check your pulse. That's great. Lovely. Thanks very much. I'm now going to look at your eyes.
Okay.
Just going to look from the top, if that's okay. Great. Now, would you mind following my finger with your eyes? Just keep your head still. That's lovely. Great. Just going to examine your neck now. That's fine. Now, would it be possible for me to check your reflexes in your ankles?
Yes.
So what I'd like to do is to kneel on the chair, if you can. That's lovely. Okay.
Mm-hmm.
And this one. Lovely. Great. Thank you very much.
You're welcome.
So in this case, the candidate was expected to actually examine the patient's thyroid status. So it's important to observe the patient holistically, look at the eyes, and in this case, she shows evidence of exophthalmos due to Graves' disease. On close inspection, you can actually see a scar, which is a thyroidectomy scar. She may have had a whole thyroid out, or she may have had a partial. Close inspection, you can actually see a scar, which is a thyroidectomy scar. She may have had a whole thyroid out, or she may have had a partial thyroidectomy. So in order to examine the thyroid status, though, once you've looked, it's important to look at the hands, make sure there's no clubbing, make sure there's no sweating, and also check the pulse. What I then did was to see if there's a tremor, and if you can't elicit a tremor just by asking the patient to hold their hands out, you need to, like I did, actually put a piece of paper onto the hand. So if you do that again, Mrs. Burnell. There's a mild tremor there. It's then important to demonstrate a lid lag. So I asked Mrs. Burnell to follow my finger with her eyes and keep her head still. And you can see there is some evidence of a lid lag there. I went on to examine her thyroid. Now, I did examine her thyroid and I could not feel a thyroid lump, or I could not feel a goiter, and therefore I did not go on to examine the rest of the thyroid, which would include auscultation and to percuss down in case there's a retrosternal thyroid. If there's a glass of water, or there may be a glass of water by the side of her, in that case you may ask her to take a drink of water and to swallow to see if the thyroid lump moves upwards on swallowing. In this case, it was not necessary. I examined Mrs. Burnell's thyroid status. On general examination, she had thyroid eye disease and there was evidence of a thyroidectomy. On examination of her hands, there was a fine tremor, she was sweaty, and her pulse was 110 and regular. On examination of her eyes, there was exophthalmos and evidence of lid lag. I did not examine extensively for a goiter, as I couldn't palpate one, and I'm assuming that she had a total thyroidectomy. In conclusion, Mrs. Burnell is hyperthyroid, and I suspect she's being overtreated with her medication. This case comes up in stage 5 of the PACES exam, and you're often asked to assess a patient's thyroid status. It's still important to have a view of the patient to see if they're fidgety and agitated, which might be a sign of hypothyroidism. After general inspection, then go on to the hands, and you can see from this case that she's hyperthyroid because there was a fine tremor and she was sweaty with a fast pulse. It's also important to comment whether she's in atrial fibrillation or if she's in sinus rhythm. Then go on to examine the eyes, and then particularly look at lid lag as demonstrated in this case. I also looked for slow relaxing reflexes in case she was hypothyroid, and of course that wasn't the case with Mrs. Burnell.